So I've been asked basically to present on the findings from our evaluation, which we conducted for the Commission. The structure of my presentation, I will first of all provide background into the evaluation, its approach, and that side of things, and then look at three specific areas where we found where we looked at how the platform was functioning, so dialogue, action, and impact. And to follow on from what Mr. Madeline said, I think it would be hopefully helpful for you to look at this presentation from the perspective of health professionals and see whether you feel that this policy tool, soft policy instrument as the Commission refers to it, works, and would you do the same? And if you would, how would you do it? And how would you do it differently if you decided to embark on such a project? So first of all, just in terms of a little bit of background to the evaluation itself, we are independent evaluators, so we are not members of the Commission, and I'm not sure how familiar you are with the Commission process of evaluation, but the Commission is obliged or required to carry out evaluations, and these are either conducted externally by companies like my company or internally by the Commission itself. The evaluation lasted for 8 months, so from November 2009 until the 1st of July of this year. And throughout the evaluation, we had periodic meetings and presented periodic reports to the Commission and a small steering group, which involved various members of the platform. Now, in terms of the general approach, this is the evaluation of a soft policy instrument. What we mean by that is that it's not legislation, and it relies on dialogue and voluntary commitments by stakeholders. Our approach was mainly qualitative, but supported by some quantitative elements. So when I say qualitative, what I'm referring to is basically we conducted a lot of interviews with various different stakeholders, ranging from Commission officials to all the platform members, to platform observers, former members, and then we also conducted a number of interviews with national platforms that we judged to be equivalent to the EU platform, and also with national authorities. They're looking at more the impact the platform was having on policy. In addition to this, we conducted quite a bit of research and we did 2 case studies, one looking at self-regulation of advertising and marketing to children, and one looking at food and drink reformulation. For those, we looked at 3 specific commitments in each case and conducted a number of interviews and carried out research in those areas. So basically those different tools that I've just mentioned allowed us to answer the 4 main overarching evaluation questions that you can see here. And under those, we had another 23 questions that we needed to answer. So we were looking at the role and the function of the platform as a place for dialogue, whether the commitments were relevant and proportionate, the impact at policy at national and European levels, and finally, as a more general question, whether the platform itself was meeting its underlying goals. In terms of what we concluded, we asked ourselves generally, in order to answer that question, we wanted to answer the question, what has the platform achieved in the last 5 years? And in order to do that, we grouped our findings under 3 main headings, which is what the little pictures illustrate. So first of all, dialogue, action, and impact. First of all, dialogue. We found that one of the main achievements of the platform was enhancing multi-stakeholder dialogue. We found that the platform has a very broad and balanced membership, with basically half-half split between not-for-profit sector and the for-profit sector. There are 9 different sectors that are represented on the platform, ranging from health and retail and catering to broadcasting. We did find that there were some areas that were potentially underrepresented, for example, the education sector, and that some other areas may be slightly lacking in visibility, which Mr. Madeline also referred to previously, namely the physical activity sector. One of the other key findings was, under this dialogue element, was that the platform had definitely increased understanding of each other's positions. So this mainly referring to the not-for-profit relative to the for-profit, I would say. This was considered to be the case to a considerable extent, and it was one of the greatest fulfilled expectations of the platform members. The relationship between the different sectors and actors over time was also found to have become less confrontational and more constructive over the years. However, there is still an element of confrontation there, which probably is quite natural in the nature of the players that are involved, and it's something that came up time and time again in our evaluation. And if you ever read our very long report, we often present, on the one hand, not-for-profit said this, and on the other hand, for-profit said this. So there are definitely divergences there that come from diverging starting points. We also found that the monitoring process had not necessarily enhanced the trust in each other's commitments, which may be an explanation for why there have been few actual joint actions between the two different sectors. There have been some, but not very many. And the lack of few joint actions was actually something that a number of members mentioned as one of the things that they came into the platform hoping would happen, but unfortunately didn't happen. So yeah, maybe there's room for more of those in the future. In terms of action, the platform has carried out 292 commitments since 2005. This was at the time of the evaluation. We found that not all of these commitments were a direct result of the platform, i.e., it's not that they would not have happened had the platform not been there. We found, though, that having looked at a number in more detail, that a lot of the activities were existing activities that had been scaled up, revised, or reframed. And in that sense, the platform had definitely added value to the activities of the members in terms of the scope, the scale, the time frame, the level of ambition of the actions, and also from the perspective of monitoring the accountability and transparency. In a number of cases, we were told that basically had these actions been carried out in-house anyway, they wouldn't have gone to the lengths they have in terms of the monitoring, and so in that sense, it's definitely added value. We were also asked, as I mentioned at the beginning, to look at the relevance and the proportionality of the actions, and we found that it was generally a mixed bag. While the majority of people felt that the level of action was in line with the objectives of the platform and was contributing to reversing the rise in obesity, the not-for-profit sector was a little bit less convinced of that. In fact, what we found is that there are a number of commitments with very wider scope that coexist with more inward-looking commitments. We also found that about just under 40% of commitments target over 50% of the population, that a quarter of commitments are self-regulation commitments, that most active commitments made by industry were linked to their core business, and finally, to contribute to this mixed bag, in terms of the target audience, most of the stated target audiences for the commitments tended to be aimed at specialized groups. However, it wasn't clear whether the commitments were actually reaching vulnerable and lower social economic groups in particular. This mixed nature led us to the conclusion that perhaps the monitoring system has not been being used to the extent or to its full potential, in the sense that the monitoring system, which Mr. Madeline mentioned before, so it's self-reporting basically by each of the individual members on their commitments. The monitoring system has definitely put monitoring high on the agenda of members, but it's not necessarily been used as its original objective was, to produce evidence and know-how, notably with a view to ensuring the relevance, proportionality, and effective implementation of platform commitments. So just to conclude on that point, it's basically been used as an end in itself rather than a way to support the implementation of commitments and learn from use it as a best practice learning tool. Also, relating to action, we looked at whether the commitments were being implemented effectively. Now, we weren't, as part of the scope of our evaluation, we weren't able to look at all 292 commitments. If not, we would still be here today looking at them. But in the case studies, we looked at a sample of commitments and found that generally implementation of those commitments had been successful. One final point in relation to action is that on communication, what we found is that external communication about the platform tended to be limited. This venue here is a good step in the right direction towards, I suppose, changing things. And it was generally felt that more needed to be done in that respect in order to encourage members to table more relevant, proportionate, and ambitious commitments. However, it's a challenge communicating more about the platform in the sense that you have these two, the not-for-profit and the for-profit sector, with very divergent views. So trying to come to an agreement on the relevance and appropriateness of commitments and how to communicate about the platform is not the easiest of tasks. And efforts had been made in the past and had not come to fruition, unfortunately. Finally, in terms of impact, it was, again, not within the scope of this evaluation to look at all commitments, but the case studies showed that they are having an impact. I'm not going to go into all the details of the figures and that side of things, but in terms of self-regulation of marketing and advertising, we found that the 3 commitments we looked at had definitely been effective at limiting the exposure. And Rocco's going to, I think, mention a little bit more about this afterwards, of children to advertising. However, we also found that the impact was limited in the sense that there's an age limit of 12 for the advertising. There's an audience threshold that's put in by the companies. Some companies have nutritional criteria, so will advertise certain products but not others to children based on their own standards or nutritional standards. So there were a number of sort of limitations to the commitments that meant that they maybe weren't having as much of an impact as they could be. In terms of the reformulation of products, which I'm assuming you all know what that means, but is basically, we found that in the 3 commitments we looked at, that the multinational corporations had a wide range of products and a large market share. They were reformulating both existing and new products, and the number of products and recipes that had been reformulated was significant, so there was definitely an impact there. We also found that there had been reductions in the level of nutrients, which had ranged between 5% and 80%, with the majority turning around the 25-50% mark. However, more could be done in terms of the points I raised before: age limit, audience threshold, the mediums covered, and the data provided. We found generally that there was an incomplete picture. In order to really judge the impact, it was partly because the monitoring system had not succeeded in showing overall outcomes and impact, but also some of the data that was provided by members was not necessarily complete. It was very difficult to compare it across the board. And there was a lack of a baseline in a lot of cases, which made it difficult to actually judge the real impact. The other element that made it difficult to judge the actual health impact was the fact that a lot of the platform was founded in 2005. A lot of the figures on health impact that we could have looked at were dated back to 2007, and there was just not enough of a time lag, basically, to really judge the health impact. Now, in terms of impact on policy, we found limited evidence of this. There were very few examples provided by the national platforms and the national authorities that we interviewed of direct impact of the EU platform on policy. However, the area where there was definitely impact was that the EU platform had inspired the development of 4 out of 6 national platforms that we looked at in particular. in that sense, you could say that potentially the EU platform is having an indirect impact in that it's influenced the development of national platforms, which then go on to influence national policy. The lack of impact on policy could also perhaps be linked to the limited level of communication at member state and local level, the limited knowledge of the EU platform, which is what refers to my point previously about the lack of a real communication strategy for the platform. In terms of, we also made a number of commitments. I've only presented on our findings here. We also made a number of recommendations, for the Commission, and it's up to them now to take those on board or not. And Philippe, who is gonna talk to that just after me, I believe. But I think for you, maybe hopefully taking away from this as health professionals, if you wanted to embark on such a soft policy project, this evaluation basically shows that it works, but it could be even better.